McCrory. I am a second-year medical student at Quillen College of Medicine. My research project that I will be talking to you about today is called Utilizing Electronic Medical Records to Improve Trauma Patient Notification of Radiographic Incidental Findings. So this was a follow-up study to a quality improvement project done in 2020 at UT Medical Center. And the goal of that study was to initiate a multidisciplinary systemic plan to increase the pre-discharge disclosure rate of incidental findings in the CT scans of trauma patients. So the Department of Surgery devised an incidental findings policy that was published in the Trauma Procedures Manual and worked with the Department of Radiology to format CT results to be documented separately with the incidental findings. A computer-based pop-up reminder in the discharge workflow was put in place to prompt for disclosure and follow-up instructions. The changes made in that initial study increased disclosure rates by over 30% and decreased days to notification by 24 days. So the goal of my research project was to analyze the outcomes and follow-up status of the patients included in that quality improvement plan. Firstly, it was found that the most common incidental findings were lung nodules, cardiovascular findings, and thyroid nodules. And follow-up with a primary care provider was recommended for 88% of patients and a medical or a surgical specialist for almost 8%. The remaining patients were already aware of the findings and had an established physician. Compliance to follow-up was determined by electronic medical records. And if it wasn't found there, the patients were contacted through a phone call with a predetermined questionnaire. This determined if the patients remembered disclosure, were able to seek care, and what the outcome of the care was. So 64% of patients were lost due to death or inability to contact. And of the remaining 36%, about half received follow-up care and half did not. 3 patients discovered that their incidental finding was cancerous upon follow-up. We also found that there was no statistical differences between the two groups, such as age, gender, mechanism of action. And when asked why they did not seek follow-up care, almost 90% of patients stated that they didn't remember being told about their incidental finding, even though we had that disclosure documented in multiple locations. So many of these patients had extended stays and traumatic injuries. So even with increase in the disclosure rates, we were seeing that the patients still left unaware of their CT findings. So the initial quality improvement plan had included the addition of CT results in patient discharge packets, but these packets averaged over 25 pages long even before that addition. These findings suggest the need for a performance improvement initiative focused more on increasing follow-up rates for incidental findings of these trauma patients. Special attention to health literacy, follow-up phone calls, appointment scheduling upon discharge, maybe some ways that we can increase these numbers. And our further research will be aimed at not only informing patients of their incidental findings, but assessing the barriers and access and actually seeking that follow-up care after discharge. Are there any questions? Okay, thank you.
All right, thank you so much.